The great thing about working in healthcare is that after having done this for over 25 years, I can still get excited about the prospects for the future. When I started out in nursing, we were filling out paperwork on any available space. So they might be writing on a garbage can. They might be just sitting down with the chart on their knee, or they've got their leg propped up on the rail of the bed. So really it all centers around improving workflow by looking at the environment we work in. Answering the questions of, is this a comfortable environment? Can it be efficient? Does it adapt to technology? And how do we work collaboratively or individually? If we can answer those questions, then that really gets a great start to how we might look at our workspaces and how we deliver care in a more efficient manner. In healthcare, we all work collaboratively. It's not an individual sport. And finding places where people can work that way is difficult. Where can these people get together and share information? There is a need for these types of hubs. You can call them hubs. Typically people call them teaming areas where a group of 4 to 6 people could meet or 12 to 15 people could meet. So one thing that, decentralizing work areas and creating it closer to where the patient is, it automatically decreases the noise level. When you have a space that supports that communication between the caregivers, where they're working in the moment, with the patient information, right there where they need it, then you end up with a better healing environment for the patient. For a long time, nurses and caregivers have designed their work around the space available. And it shouldn't be that way. Why can't a workstation be designed around how caregivers work? Whether it's a place to work individually or a place to work as a team. So we need to do something that takes up less space, but allows a lot of people to work together. We don't want to build the same old thing. We need to get beyond the 70s and 80s of healthcare. But I think the best thing for the caregivers is to have that space, this hub to move to where they have the computers they need, they have the workspace they need, all the information they need to make decisions about the plan of care. And they actually can collaborate with physicians and pharmacists and social workers, because when you really talk with them and discuss the patient together, then you really create a better plan of care for the patient. All healthcare facilities have one thing in common. No two caregivers are alike. You have tall nurses and short nurses, you have tall doctors and short doctors, and nurses who like to sit at a workstation. At other times that space could be used by someone who's just walking by. They need to look up some information. They're going to be there for 20 minutes, and if they want to stand, they'll choose the standing position. And if they want to sit, they can sit and use their monitor and look up the information that they need. Or it could be used just for a couple people collaborating. For example, if I want to change the view on my screen or I want to move it for someone else to look at, it's much easier to grab it like you would a steering wheel and move it around. It feels a little more, it's easy to use, it's flexible, and you can stack your screens on top of each other if you want to look at a couple different views at one time. So it gives you a lot of flexibility there. Nurses are on their feet for a long time. They're standing a lot, they're walking long distances, and sometimes you're tired of standing, and just resting your foot on something a little higher takes that pressure off. I think it's important to have adaptable workspaces. So many healthcare facilities have these fortresses that aren't flexible to change. After 5 years or so, they're already out of date. We need the space to be adaptable. It needs to allow for change. It can't be fixed or inflexible. When I think of adaptability in terms of hospital staff, I can't get over how many people have trouble letting go of old habits. Just look at paper, for example. There's no need for it anymore, yet most hospital workspaces are cluttered with it. Of course, reducing paper is meaningless if the workspace is still cluttered with technology. Creating spaces where we have computer workstations and controlling where the CPU is, that's important to me as a caregiver. If we have things sitting around on the floor, they're kicked easily, they get in the way, but I also don't want to see dust all over cords. So they need to be contained, and they need to be designed so people don't notice them so much, and that they're where they need to be. We want the technology component to be easily changed, easily switched out, and easily serviced. I think once nurses see and experience a better work environment, they'll get it. Then they're like, I'd never go back. When we can work together in an environment that allows us to involve the patient, involve the family, and use technology to our benefit, we can see where the future of healthcare can take us. A lot has changed, and we're going to see a lot of change in the future too, and patients do recover when you have certain environments. They recover faster, and that staff actually can work better. All from just rethinking the way a healthcare environment operates. And when families and patients tell you that they love the environment, they love the fact that they feel welcome in that environment, it's what you're all about. That's why you're in nursing, that's why you're in healthcare, to care for people and to care for the people that you work with.